High and Wealthy Countries by Jessica Hawkins. Why this topic? When I was reading in our text, approximately 2.7 million newborn babies die every year, and an additional 2.6 million are stillborn, according to the World Health Organization in 2015. When I was a little girl, about 7 years old, I was excited with anticipation. We had a new baby being born, and we were sitting there and we were coloring and we were all ready for this baby to come home. Aunt Rita was so excited, and then the phone rang. And then Aunt Rita just wasn't right. She couldn't quit crying, and she kept going to the bathroom, and we knew something was wrong, but she didn't tell us. Our parents wanted to tell us. Rachel Elizabeth Redmond was born on the 21st of January, and she never cried. To the definition, the stillbirth is the death of a fetus before birth and after 28 weeks of gestation. Is it a problem worldwide? It appears that perhaps it is. When we look at this graphic, it shows us that in year 2009, we have a significant amount in Africa, as we would expect. Some up here in this Europe area. And then also we look at this and we see, well, the United States rates are about 5.94. And you can see a lot of areas that are very similar to us. When we start looking at those areas, a lot of those areas are areas where there is high income. And so I thought, well, maybe I'm misunderstanding this stat, so let's do a little bit more investigating and see what we can find out. Annual rates 1.7 to 8.8 per thousand births in high-income countries. There are higher levels in economically deprived persons when we break down that percentage as opposed to those that have a higher income, and also higher in minority and ethnic groups. So there we have it. In high-income countries, those are the statistics that we found that made up that 5.8% across the world that we looked at the previous slide. So I wanted to look at some modifiable risk factors. And so when we look at this graphic, it talks about the odds ratio, the population attributable risk, and the population exposed. And I found this graphic very interesting in regards to our odds ratio, which is the middle, tall, darker rust color bar. When we look at that, obviously the highest is small for gestational age. Then we went to look at like the population attributable risk. When we look at that, there are some very interesting things that we can see. We're still very high in the small for gestational age and very low in the area that is addressed in one of the resources about going to sleep supine. So going to sleep supine is something that most mamas are educated on by their provider. So, or somebody else along that's knowledgeable and has had children. So why are those mamas not being educated about that? Or are they, and they're just choosing not to sleep that direction? Then we want to look at the population exposed. So when we look at the population exposed, we look at the areas that we've looked at all along for the small for gestational age, smoking during pregnancy, obesity, overweight, and supine going to sleep. That one struck me when we look at overweight being higher. So let's look at the difference between overweight and obesity. Overweight is anything over a BMI of 25, and obesity is anything over a BMI of 30. And the reason why that causes so many more complications is the promorbidities or the comorbidities. When we talk about that, we're talking about diabetes, heart failure, all of those sorts of things that cause us a little bit more complication. When we look at this, the top three that I pulled out were fetal growth restriction, placental insufficiency other than previa or abruption or abruptio, or non-relative condition identified, so we can't figure out why exactly. So when we look at fetal growth restriction, that one struck me as high. We look at the number of cases versus the percentage. This is in the United States, and so when we look at this one's based off of the sleep practices reference that I gave you. 45.2% have fetal growth restriction. I had a child that had that as well, and so the cord being wrapped around his neck was very scary, and being in a rural area and needing to travel out of town to have somebody qualified to help deliver my baby safely was one of those interventions that we needed to do because we didn't have anesthesia available here, nor did we have a practitioner that could do an emergency C-section. The placental insufficiency was there. We often hear about the previa and the abruption or abruptio at 16.4%, and then we move down to the 14.4% where we have no relative condition identified. So when I look at this, that fetal growth restriction is very high, and I don't know what can be done about that as far as preventing that. To me, that's astronomically high. And then the no relative condition identified, that also is quite high in my mind. The placental insufficiency doesn't pick up to be such a, it is a large number, but I don't know what we can do about that, and it didn't surprise me. Large numbers are undefined. We talked about that. Can we identify and intervene in acute infections and diabetes with prenatal care? Of course we can. So some of the stats that I didn't put on here when we look at it are 4.5% were because of acute infections and 3.1% were because of diabetes. Well, those both can be managed through appropriate prenatal care. Graphics and statistics. So now we've talked about world, we've talked about the United States, and I wanted to break it down into Kansas. So we're talking about a Kansas percentage, and the information that I've been able to gather is from 2012 to 2016. So this information reflects the percent of live births for those mothers receiving prenatal care. The data was provided by the Kansas Action for Children. And so when we look at this data, the lowest we had was 81.9 and the highest I can find is 83.6. But what strikes me with this graphic is that there's really very little fluctuation and very little improvement. And I feel like from 2012 to 2016, we ought to be improving that number and increasing the percentage of live births per 1,000 births. So let's look at the United States. So we see a stagnation. We see that it's about 6% yearly from 2011 to 2015. Really no variation. Again, I wanted to reiterate that we're at 6% according to the CDC. So that concerns me. Why are we seeing such stagnation? Why can we not improve this problem? So I got to thinking about healthcare coverage. Was healthcare coverage beneficial? Did that help? Well, if you don't have the ability or the know-how to get into the healthcare coverage, which we've done Obamacare at our house, and it's not the easiest thing in the world. Also paying the premiums, then you have high deductibles. So all of those things make it very difficult to be able to use that healthcare coverage and for it to do what it's intended to do. We continue to have higher percentage of stillbirths in ethnic and low-income populations. So when we look at that 6%, the largest percentage of that 6% are in the ethnic areas or the low income populations. So it makes me wonder, are we missing the boat? strong suit, even though I love statistics and looking at them. I don't know about so much figuring them. Sometimes I do, but anyway. But I wanted to show you the equation that I put together to reflect all of the information from the past few slides. So the location specific to address the barriers. So I feel like one of the things that we need to really hone down in is that what we're doing needs to be location specific based on the people that live there, the barriers that they have in those particular areas. Just like they did back in the past, where the young midwives got up on their horses and went down through the Appalachian Mountains, or when when Florence Nightingale addressed the issues during the Crimean War, and how she just got right out there and did some things very specific to manage those specific issues, tracking them by evidence-based practice, trying to see what kind of improvements we could make. So I think that, plus making sure that we get the pre and postnatal care that is needed, which can't be done without the top one, thus the plus, will equal a reduction in stillbirths in the United States. And as we all know, we are someone that people copy after and we are willing to teach. So I believe that that would reduce stillbirths across and around the world. Thank you so much for your attention and your help with this project.